In this video, we'll discuss about what are the anticoagulant used in blood bank. So, what is anticoagulant? Anticoagulant is a chemical substance that prevent clotting of blood. So, it is a chemical substance that prevent clotting of blood. In daily laboratory, we use EDTA, ethylene diamine tetraacetic acid, then TSC, trisodium citrate, as anticoagulant. Daily laboratory we are using EDTA and TSC as a anticoagulant. They provide 4 or to 1 days preservation of blood component in normal state. So provide 4 hours to 1 day preservation of blood component in normal state. In blood bank we can store for long time, 7 days, 21 days, like that long time we can store. So we need some special type of anticoagulant, 1 year, like that. So we need special type of anticoagulant. Here we want to know some terms in for blood banking. First one is citrate. Citrate, it is a xylate calcium, thus prevent blood clotting. In this coagulation, how can blood clot without this calcium? So calcium is important factor. Remove the factor by citrate. So here we can remove that calcium because it is a silating agent that prevent blood clotting. Second one is citric acid. Citric acid prevent caramelization. Caramelization is nothing but just a oxidation of glucose. Oxidation of glucose, brownness of glucose by heating during the process of autoclave. Why required this autoclave? When the solution is prepared, we have to sterilize that solution. Maybe there is infection during the formation of this anticoagulant processing. That reason only we are using anticoagulant. So here caramelization means oxidation of glucose, brownness of glucose by heat. Then we are using sodium dihydrogen phosphate. It acts as a buffer. This sodium dihydrogen phosphate, it acts as a buffer maintaining that pH. Then saline. Saline is the isotonic solution for RBC and other cells. Then dextrose acts as a nutrient. Dextrose acts as a nutrient to provide energy to that RBC. Then adenine. Adenosine is the adenosine monophosphate, adenosine triphosphate. So adenosine is the one important component. So this adenine is the substrate for ATP synthesis. Then mannitol. Mannitol is the sugar that reduce the hemolysis of blood and increasing lifetime of that blood. So mannitol is the sugar reducing hemolysis of blood and increasing lifetime of that blood. So these three things, dextrose, adenine and mannitol, increasing storage time of blood in blood bank. So what is isotonic solution? Isotonic solution is the solution same concentration of that water. Then dextrose, adenine and mannitol. Then types of anticoagulant in blood bank. First one is ACD, acid citrate dextrose. So this is the core component. The basic component containing trisodium citrate, it acts as a silating agent. Then citric acid prevent oxidation of glucose. Then dextrose. Dextrose is a sugar, act as a nutrient. Then distilled water, it provide liquidness to that salt. So we will take 49 ml of ACD, acid citrate dextrose, for 350 ml of blood. We can store 21 days for at 4 degrees Celsius. So ACD, acid citrate dextrose, 49 ml for 350 ml of blood, stored 21 days at 4 degree. Another we have CPD, citrate phosphate dextrose. It containing trisodium citrate, citric acid, dextrose, then distilled water. So here um, in ACD we add buffer. It means sodium dihydrophosphate. It will maintaining 2,3 this phosphoglyceric acid level. During the carbohydrate metabolism, lactic acid is formed and it will decreasing the pH of blood. In the decreasing pH, 2,3 dpg level also decrease, and finally it will affect our RBC. So now in this solution of CPD stored at 21 degrees Celsius at 4 degree, as same as ACD, acid citrate dextrose, because this here buffer sodium dihydrophosphate maintaining 2,3 phosphoglyceric acid level. Next one is CBDA1, citrate phosphate dextrose adenine 1. Here we have that component trisodium citrate, citric acid, dextrose sugar, phosphate and distilled water. Okay, along with adenine. Adenine acts as a substrate and increasing viability. So viability of RBC, lifetime of this one CPDA1, 35 days at 4 degrees Celsius. So this one 49 ml of CPDA1 for 350 ml of blood. Second one is CPDA2, citrate phosphate dextrose adenine 2. All the components similar, but here all the things similar, just increasing amount of adenine. So addition of more amount of adenine, CPDA1, it becomes CPDA2. Addition of excess amount of adenine, so this it have the name 2. Addition of adenine gives lifetime 42 days. There only 35 days, here 42 days at 4 degrees Celsius. So in this one 49 of 9 ml of CBDA 2 for 350 ml, same things, but here addition of adenine because of it increasing that lifetime 42 days. Next one CBD SMGM, saline adenine glucose mannitol. It also containing that component trisodium. Here CPD acts as a anticoagulant. This SMGM acts as a additional solution. So trisodium citrate, dextrose, phosphate, adenine and distilled water. Their lifetime 42 days at 4 degree. Here 49 ml of CDP for 350 ml of blood and 80 ml of saline adenine glucose mannitol we want to take. So 49 ml of CPD, okay, for 350 ml of blood. Here 80 ml of this saline adenine glucose mannitol. So in blood bank we have 4 type of blood bank: single blood bank system, double blood bank system, triple blood bank system, and the quad, and the final one quad blood bank system. So here single blood bank, it containing only single blood bank. Extra blood bank name is called as satellite bag. So the saline adenine glucose mannitol bag with the help of tube, okay, with the help of tube which is connected already to that primary blood bag. Thus we separate the blood. We can cut it here, and store separately. In the case of double blood bag, it containing some extra blood bag. So our main blood bag is called primary blood bag, in which collect blood. Addition of extra blood bag is into that primary bag is called satellite bag. If one extra bag is attached, it is called as satellite bag 1. Another bag it attached it called satellite bag 2. Then it another bag is attached means satellite bag 3. Now the primary bag containing CPD, which act as a anticoagulant. After centrifugation, RBC settle down, we can transport them. RBC can be stored longer time, 1 year. For that we use this technique, name is called cryopreservation. Cryopreservation, because this cryopreservation to maintaining preserving internal structure and functions of living cell during ultra low temperature and freezing. So in this one we are using glycerol and dimethyl sulfoside. We can store the blood into 4 degree, but in case of cryopreservation we want to add, in the case of RBC we can use glycerol, in the case of platelet we can use dimethyl sulfoxide. Next, finally, how much volume of anticoagulant will take for how much amount of blood? For 100 ml of blood, we are using 14 ml of anticoagulant. 350 ml of blood, 49 ml of anticoagulant. 450 ml of blood, 63 ml of anticoagulant. So, in this video, uh, we discussed a different type of anticoagulant used in blood bank. Thanks for watching.